am Erica Francois. She mentioned I am a nurse practitioner. I have been a nurse practitioner for over 11 years. I started my focus in bariatric surgery, which is weight loss surgery. You all may have heard of the gastric bypass, the sleeve gastrectomy, and I also do weight management. I started that 7 years ago, and I've been on this journey in helping others with weight management at Tampa General Hospital in Tampa, Florida. And I just recently opened my own practice as of June 2nd, New Vitality Health and Wellness, where I also help others with weight management.
Well, congratulations on opening your own business.
Thank you.
That's exciting.
Thank you.
So it sounds like let's give her a hand.
Thank you.
Let's give her a hand. So it sounds like you have a passion for weight management.
Indeed, yes, I do. I consider myself a patient as well. I have had the struggle with obesity as well, and not just, sometimes we look at it just for looks, but it affects our health. I was not able to start working at Tampa General Hospital. You know how we go through like pre-employment screening, and my cholesterol was too high. I did not know that, and I had to be under a doctor's care first. There may be some pictures pulled up pretty soon too that you can that I will share with you all. But I decided to change my lifestyle, of course with Christ first, and then utilizing a dietitian and a doctor, and I was able to lose close to 70 pounds. Wow. And my cholesterol, I did not require going on medication. It was through lifestyle changes and making changes in my life with food and, with activity.
So, our program today is called Living Your Best Lifestyle.
Yes, ma'am.
I love that. I think that's a great topic. And sometimes we say living your best life, but it's really about the lifestyle that we live that determines how well we live.
Yes.
So tell me about obesity. I heard you refer to the word obesity, and sometimes people have a misunderstanding what that is. So can you tell me a little bit more about what is obesity? So
obesity, we just, I believe in 2013, it was named as an actual diagnosis, an actual disease. Sometimes it's looked upon as we just eat too much, but that's not always the case with obesity. Obesity is an excess of fat tissue in the body, and you all probably have heard of your body mass index or BMI, and this is just a tool that is utilized to determine, what classification of obesity or overweight or normal body range that we should be in. But it's utilized just as a tool that we use to help us determine if you are obese. And we are now trying to really focus on treating obesity as we treat any other disease, as we treat hypertension, high blood pressure, as we treat high cholesterol, changing up your diet and your lifestyle first. And if that does not work, then we move on to medications. And sometimes surgery is necessary as well. So that's obesity. And
so can obesity be, can it be in your genes, or can it be hormonal?
Absolutely.
Okay.
It is genetics that can play a factor in obesity. Hormones, different. Our thyroid, you've probably heard of Cushing's disease, hypothyroidism. All of this plays a factor in obesity.
Wow. So how do you know, whether it's hormonal or hereditary? So how would someone know that?
Sometimes, you can't tell if it's hereditary, right? I mean, just, you could look at, your family history and our makeup, right? We can tell, grandma, grandpa, great grandma going back, and you can tell that there is a genetic factor that plays a role in obesity. And then as far as hormones, there are different tests that have to be done to determine if it's your thyroid or some adrenal gland problem that may be going on.
So do you find that there's more obesity in males or females, or about the same?
Of course, poor us, right? Poor females. the obesity rate, and this was alarming to me, African American women, we have the highest obesity rate. 4 out of 5 African American women are considered either overweight or obese. And this is very, very concerning to me, and I hold this precious to my heart, that I want to be able to be a change factor in this, in changing this. I know the world is big, but it just takes one, right? And we can change this. I want to be one of those people to help change the numbers, change this up, change that our obesity rate is so high. But I know a lot of things play into this. Our culture, sometimes we see this as, being quote unquote thick, or, you've probably heard the term that's what that's appealing, and that's what they want to see. But we need to be very careful about our health, making our health primary and first. Obesity it plays a role in over 66 diseases that occur in our body. Obesity is linked to cancer. Obesity is linked to heart disease. Obesity is linked to sleep apnea. Obesity is linked to hypertension, high cholesterol. You name it, obesity is linked to it. So a lot of times, if we treat the underlying factor, we treat obesity, I oftentimes see this for myself firsthand with my patients. We treat obesity, then we're also treating diabetes. We're also treating hypertension. I have some patients, they're no longer taking, their blood pressure medications anymore because they have lost, 10% of their excess body weight. And that is evidence-based, that if you can lose up to 5% of your excess body weight, you gain some years onto your life, and you also decrease your cancer risk as well.
Wow, so living your best lifestyle.
Yes.
It's about knowing your BMI.
Yes.
Knowing whether or not you're in range or not. And then also making adjustments if you're not in range.
Right. And I always say seek out to your primary care provider. We, like I mentioned, as far as BMI, we don't rely on it too heavily. There are other methods that we do utilize, such as like your waist circumference, to determine if you are obese or overweight as well.
Wow. So what about, we talked about family a little bit. So a lot of times, is it diet related sometimes?
Environmental, yes. Sometimes our socioeconomic status can play a role, in obesity. There we don't have access to some of the, healthier foods, or just the actual knowledge. Sometimes there's a lack of knowledge of knowing what's healthy for us, or what's the better choice for us. Sometimes I have patients that come in and they'll, tell the dietitian, oh yes, I'm eating vegetables, I'm eating, collard greens and cabbage, but sometimes the question is not asked to the patient, and I get them, I'm like, okay, what's in your collard greens, ma'am? And what's in your cabbage? And so when we start adding on the meats and the oil and on the salt in these vegetables, it's not really, that nutritious anymore for us. So.
So let's talk about child obesity. Do you see much of that?
Yes, that is on the rise. 1 out of 5 children are considered either overweight or obese. And again, we talk about genetics. Also, we all now see too, children don't go outside that much anymore. And that plays a huge role. Their lack of activity, they're into, video games and, social media. And we just need to get them outside just a little bit more, as we used to be growing up. Also, they're, sometimes we have this push to tell our kids that they have to eat all of their food on their plate. And that's not necessary. Of course, eat all your vegetables, right? But forcing them to eat all of the food on their plate, it plays a role for the long term in increasing their risk of becoming obese. So it starts from that age. Yes, we want them to eat all of their vegetables, but everything else, they can leave the hot dog. If they don't finish it, don't worry about it, throw it away. I had a doctor tell me sometimes it's better in the garbage than in our bodies. We are temples of God. So don't put the excess in our body. Put it in the garbage. It's okay. Or save it for later for us to put it in the garbage later.
I love that answer. So, you know, in the Bible it says, whatever you eat, drink,
Yeah.
or do all to the glory of God. So what you're explaining is how we care for our bodies as God's temple.
Yes.
Plays a very important role whether or not we live our best lifestyle. So we've talked a lot about how obesity comes about, but what I love for us to talk about more is where's the first step when we decide I'm obese or the doctor says you're obese? What is our first step of actually trying to take corrective action?
The first step, I always recommend my patients to take a log of what you're eating every day, like track it. So there are many apps out there that you can use, like MyFitnessPal, Lose It. I forgot the name of your Fitbit. That you can track your food, and it's gotten so advanced now. Like you can even use your phone and just hit the QR code on maybe something that you have, and it'll track it for you. I always tell patients, start tracking what you're eating. You'll be surprised, because the first thing I always hear is someone comes to my office, oh, I really don't eat that much. And I'm like, okay, so let's go through your day. And I don't want you to like try to recall it from your head. No, I want every time you put something in your mouth, I need for you to write it down or put it in your food tracker. And we would be pretty surprised, you know, how much we have consumed in one day. But just by doing that. Also, like we mentioned, you know, go to your primary care provider. They may refer you to a dietitian to help you manage your plate as well. I always recommend to get rid of all the sugar-sweetened beverages. It's very easy, right, to do. No sugar-sweetened beverages. Don't drink your calories. So choose water. You know, of course, we know that's the purest form. That's our filtration system, ultimate filtration for our kidneys, all of our major organs. Choose water. Get rid of all of the sodas, the juice, and sometimes we get a little. We'll say, oh, it's all natural or all, but sugar is sugar. Whether it's all natural and that grape juice is still sugar. So get rid of all of that, all sugar-sweetened beverages. I would say eliminate from your diet. And also at your exercise, where are you with that? How often are you moving? And become mobile. And every little bit helps. Park a little bit further from the grocery store. If you're going into a department store, park a little bit. Don't always try to look for the first, parking space. If you're able to. Even at home, you can do exercises. I always recommend that if you're washing dishes, do some calf raises while you're standing up washing dishes. We all like to wait till the water gets hot before getting in the shower. Do push-ups against the wall, something. Just stay active as much as possible too.
Wow, what great advice. So I know while we've been here at camp, we've had a gardening class to help people do their own, grow their own food, to kind of get them out and about, and that's exercise.
Yes.
In the garden.
Yes.
We've been doing the morning exercises at 5:30 in the morning, and then the senior exercises at 4:30. So we're concerned about the health and well-being of our constituents. So we're offering those things here to kind of jumpstart them.
Yes.
So when they get home, they'll have at least a start. So let's talk a little bit about, now I agree with you about the foods we eat, our exercising, but sometimes people want to lose weight quickly because they want to get into that wedding gown or they want to, they have that family reunion, or maybe they have a class reunion coming up. So they may go and want to do these like quick diets, pills, or tell me more about what your thoughts are regarding that.
And I'm an advocate for that. I look at it holistically, a holistic approach. A lot of medications they are, remember, as I mentioned, we want to treat obesity as if we treat high blood pressure. So, we might be on high blood pressure medication to help with that, along with changing our diet and lifestyle. Same with obesity. We change our diet and lifestyle, but there are medications out there that can help us with weight loss. Now, the new up-and-coming medications that are, a lot safer than what we probably had in the past. You probably heard of, it's big in the news right now. It's actually a diabetic medication, Ozempic, Wegovy. That's the weight loss form of Ozempic. There's Mounjaro. They're classified as GLP-1 medications. And so what it does, what these particular medications do, and it's an injection once a week, very small needle. What it does, it helps to slow down our digestion to make us feel full for a longer period of time. So you no longer have that desire to eat, because you have this feeling of fullness all of the time. And if you try to eat over the medication, you will have some consequences. There's likelihood that you can experience severe heartburn, nausea, vomiting as well. So you don't want to do that. I have utilized these medications in my practice and have seen excellent results with the medication, with minimal to no side effects with the medication. Now, you have to, again, be careful with it. You probably see a lot of med spas, but you want to go to your healthcare provider or someone that is certified in utilizing these medications, because there are, with any medication, right, there are risks, and you want someone to really go over your current medications that you're on to make sure there are no contraindications. Also, if you have a history of medullary thyroid cancer, we do not recommend these medications for you. And then at the same time, as I mentioned, it was actually first used for diabetes, so it's treating your diabetes and also, treating for helping you with weight management as well. So and now we're even seeing with Ozempic and Wegovy, we're seeing that it's also helping with addictions. I've had several patients that I wouldn't classify them as alcoholics or anything, but they always have to have a glass of wine before they go to sleep at night, or they do consume alcohol. They no longer have a desire for alcohol anymore. It's just been amazing, alarming. My mom, she watches the news every day, so every time she sees the word Ozempic or Wegovy comes up, she presses record so I can watch it and make sure that I'm on the up and up with the information that I'm giving out. And she mentioned this to me as well, but I've also seen it in my patients. They know that their alcohol consumption has been reduced, and those that are smoking as well, tobacco use, that has also gone down with utilizing Ozempic, Wegovy, these medications. So they work. It will help. It'll keep us from being hangry, hungry and angry. As we're trying to make these lifestyle changes, we can utilize the medications to help us as we're making it makes it a little bit easier, to go through the lifestyle changes.
Great. So it sounds like one of the first steps is go to your doctor.
Go to your doctor.
Develop a plan. Follow the plan.
And then get the food. Track your food. You'll be surprised in some of the things we eat.
I think we should pause for a moment and ask people if they remember what they ate in the last 24 hours. See if they can remember what they ate.
I don't even remember what I had at the cafeteria an hour ago. So
now the reason I say that is that's the importance of writing it down.
Writing it down.
Because we don't remember everything that we've eaten in the last hour, 24 hours. And when you go to your doctor, that information is critical as they develop a plan for you.
Exactly. Yes, ma'am. Yes, ma'am.
So I think, Erica, people may have questions.
Sure.
So I would love to give them an opportunity, but if not, we'll continue to talk. So let's give them an opportunity to, any questions?
There's
Okay.
one.
So I may have to share my mic.
Oh,
If you can stand up.
Well, let's speak for those online too. So they want to hear you as well.
If,
My question is related to the medication you just talked about, Ozempic. Let's say if someone start taking that medication, for how long must they remain on it?
That's a good question. Yes. Oh, so what she asked, if you didn't hear her, how long can you stay on Ozempic or Wegovy? It's approved for long-term use because, as I mentioned, it's a diabetic medication. You can stay on it for long term, and I'm glad you asked that. I get a lot of questions. Well, what happens when I come off of the medication? Will I regain the weight? So this is why we really focus on making those lifestyle changes while you're on the medication so they become habits. And when we start weaning you off of the medications, those habits are still there. They're instilled into your brain that okay, no sugar sweet beverages. I know that. I can't have that. I need, a high protein diet. Let me stay away from, the sweets. As you are, when you're on the medication. So when you come off of it, you still have those habits that you developed while on the medication. Will you be hungry after you come off of it? Absolutely. Yes. However, now you know what to grab, right? We're not grabbing the potato chips. We grab the apple. We're not, grabbing at the soda. We grabbing that, the water that we can infuse with fruit to, bring about a little bit more flavor when we do get a little bit bored with, water.
any other questions?
Yeah.
Thank you. What do you think about the raw diet? I've heard a lot about that as far as nutrients are concerned. What do you think about the raw diet?
Raw diets are great. They're excellent. However, so our plate must be include. We want to have our protein. When we look at our plate, I guess I should have had a picture. I'm sorry. We want half of our plate to be vegetables, the other half to be protein and a starch. So sometimes that's the only concern when we do all completely raw, like, we might miss out a little bit on the protein factor when we do, just the raw vegetables. Also, you want to, and that's fine to do that too, but I always like to, teach my patient, educate my patients on implementing diets, and I don't even like to call it a diet, but implementing lifestyle changes that we can do for a lifetime that's sustainable. In our culture, it's kind of hard, to be on a raw diet for a lifetime. Some can do it. I can't. So, I always put that into their brains. Like, there are a lot of different diets. There are short term, that we can do, but I want you to be able to do something that you can do for a lifetime as well. I think we had some more questions in the back too.
I have a question over here to your left.
Oh, where is he?
That other left. Yeah. I'd like to hear your comments on the injection as opposed to gastric bypass and complications that might be occurred.
So the injection as
opposed to the
gastric bypass. So, and I don't think I went in that order. So yes, we would try to make the lifestyle changes first, medications, and surgery. Sometimes we do require surgery, gastric bypass, the sleeve gastrectomy. When we maybe need just a little bit more extra help. Actually, now the gastric bypass sleeve, they're considered one of the safest surgeries. It's safer than getting your gallbladder removed. They have advanced the technology so much. We do it with, at Tampa General Hospital, we do it robotically. And it's pretty neat to watch, you know, that the surgeon looks like they're playing a video game and there's the robot doing the surgery. But it decreases with robotic surgery, it decreases, you know, surgeon fatigue when they're operating, because, you know, they're just operating a little, looks like a handheld controller as well. So it's very, very safe surgery. Our patients, they go home the next day. Wow. And we follow up with them very, very closely. And so sometimes, yes, we do need to get the weight off. We do this for our transplant patients. That there are some patients that need to have maybe a heart transplant, a kidney transplant, and they need to lose the weight pretty quickly. So, you know, they are our priority patients. So we do, you know, maybe the sleeve gastrectomy so they can go on and have their transplant. Yes, ma'am.
I have a question. I got in here a little late, so you may have answered it already, but you were talking about the medications that we can take, right? For that, our diabetic medications. So if you're not a diabetic, you still can take those? And if so, are there any side effects that we would need to be concerned about?
A very, very good question. Yes, you can take the medications if you are not a diabetic. They are, so basically, when you are not a diabetic, your pancreas works, so it knows how much insulin to release and to hold back. So the medications will not affect. We always recommend when you're on these type of medications that you eat small meals, small frequent meals throughout the day. If you are able to, just to make sure, and you should not have any issues with, you know, there's always concern, oh, will my blood sugar drop or something? In most cases, no, because your body, when you're not a diabetic, it knows how to release the appropriate amount of insulin throughout the day with each meal.
I saw another hand.
My question is, how can I get rid of my big stomach that, you know, so many of us have, because we do our sit-ups, we do our push-ups, we do all the ups, but still there.
So there is like no such thing as like spot training, like, oh, I'm just gonna lose weight in my hips, so I'm gonna just lose weight in my arms. That's not, that has to be surgically done. So we just have to focus on losing, you know, everywhere. So as you're losing weight, your stomach should go down. There are some foods that, and if you feel like your stomach, if there's a lot of bloating or something, you do want to see, like maybe you should see your doctor so you can see a GI specialist. There may be something else going on that we're not aware of, and you're just thinking, oh, I just have, a big gut, and I'm doing all this exercise. Go and have it checked out. Don't be afraid to go. I'll tell you, everyone, don't be afraid to go to the doctor for anything. And I think sometimes I know it's like that's like a whole nother presentation. But if there's some concern that you have, go and get it checked out. If you don't think that they are treating you as you should, and we know our bodies, right? You know your body. You know when it's not, right. Go somewhere else to get it checked out. So it might be something else going on, but to answer like the generalized question, we can't like really spot train ourselves to lose. I'm only gonna lose weight in my my butt or something. We can't do that.
Yes, as far as the big stomach is concerned, I found out that my high carb diet contributed to the large stomach. And what helped me was, lowering that in my diet. But that's an awful thing to suffer with the stomach like that, because you don't know what to do about the gas and bloating. But that was the big thing that worked for me. And as far as getting my protein is concerned, I had to gravitate toward eating lots of seeds and nuts and what have you for my protein. But yeah, that's what helped me. I just wanted to interject that.
Dr. Francois, I like that you don't use the word diet. You talk about lifestyle.
Right.
So I really like that, and I think our audience, we want that to be the message, that the lifestyle that we live can help us live our best life.
Right. Your diet, sometimes we think, when we say the word diet, we think of something that's short term. I'm going on this diet for 10 days or 30 days or 40-day diet plan. But I want to promote, lifestyle changes, that it's not something that we do just for 30 days or 40 days. We're going to do this for 30 years, 40 years, that we're going to make these lifestyle changes. Also, I guess he can show, if we show the pictures as well, there was that's me. You see me holding Morgan. That's when I found out that my cholesterol was through the roof, and I had no idea. I thought I was living my best life, yeah, but not so much. And then the other picture, and there's Pastor Francois. So when mommy change or the wife change, everybody in the household changes, right? So he had to start eating the way we couldn't go out to eat every night anymore, and we had to cut back on the sweets. And as a result, I got jealous, because men, y'all had stopped eating, for 2 days, and you lost 20 pounds or something. So I'm like, how you beat me at my own game? But that is Pastor Francois. That is Tamar. You probably all have seen her around. She's in our conference too. She was the nurse on duty last week. Had you asked Tamar maybe 3 or 4 years ago to be the nurse, she would be quick to tell you no, because she wasn't able to mobilize and move about as she's able to now. She's lost over 100 pounds, and she's doing an excellent job. She's now a registered nurse, and she has done marvelous with changing her lifestyle and has changed her life.
Wow.
And that's one of my patients as well. You see, she's holding the baby, and she came to me with postpartum blues sometimes, concerned about your weight and everything. And she's done, except she's one of my first, I call her my graduates in the program.
So, Dr. Francois, let's talk a little bit about support systems. Because whenever you go through any change in life, whether it's good, bad, or otherwise, you need support. So what suggestions would you give to our audience about, as they begin to make lifestyle changes, what type of support system should they seek out?
Yes, because sometimes talk to your family, like who lives in your household. That's always the best, because they're responsible for what's in the refrigerator. And when you have, like, your spouse is on board, or whoever's in your household is on board with you, it makes it a lot easier. It makes it so much easier when you have the person closest to you on board with you. And if you can't find it sometimes in your own house, sometimes you do have to go out and join different groups. At where I currently work, we have a support group where patients can come even like after their surgery, and they meet every month, and they're able to talk amongst themselves, because it's a journey. So it's not a race, it's a journey, and it can be a little rough at times. So you really need someone to talk to, and of course our biggest support is Jesus. And then sometimes we have to talk to him, and I even myself, I'm like, all right, Lord, I don't need this piece of cake. So I need you to go ahead and just get it out of my brain, Jesus, to not eat this. And sometimes we have to talk to ourselves and talk to God, talk to Christ. But it's always a lot easier when you make it like maybe a family. Right now, it's in my own family. It's almost like a little friendly competition with weight loss, sometimes unfriendly, but for the most part, friendly competition. And it just makes it a lot easier when you go to different events. Everyone knows, no, we know we can't, have this. We try not to have functions now that that is circled around food. You know, a lot of times, birthday, we want food. You know, any type of event, there's a graduation, oh, let's go and eat. So now we're trying to have events. Is there someone's birthday? Okay, let's go play kickball. Let's go and do top golf. Let's do something else. That's not so food focused.
Absolutely. So we had a few questions from the internet.
Okay.
And there was a question regarding about the medication, how long to take it. We've answered that. I think we've answered that
Well,
pretty
what did they ask? How long did it?
How long do you take the medication?
Oh, yes, so it's approved for long-term use.
And then there was another question about black seed oil good for health issues. So I'm not that familiar with black seed
I
oil.
am not either. Some of the those that I might have to get like our herbalist that are custom. I'm not sure about the black seed oil.
So we've talked about from the beginning about how obesity comes about.
Yes.
And then we've also talked about how to correct it, how to start the journey to lose weight.
Yes.
And we've talked about the importance, and I think what we want to keep it in the context, like you said, Jesus is the only one that can help us. I love the verse in John 10:10. It says, I've come, well, let's back it up. The thief comes to steal, kill, and destroy our health. But Jesus says, I've come that you may have life and have it more abundantly. So we have another question over here, and we'd like to take that question as we wrap up.
I just want us to focus a little bit more on menopause, because menopause has a way of actually stifling our metabolism, and we gain weight, we have cravings, and I'd like for us to kind of address that, because I've tried a lot of different diets. Once upon a time, I could have just think I want to lose weight and lost the weight, and now it's a big it's a big task, and I'd like to see how we focus on that, because I also listen to different types of diets out there, and they talked about the mitochondria and how the cells becomes dead as you age, and those cells need to be rejuvenated. Can we kind of focus or talk about that as well, please?
So it's for with menopause. So the more birthdays we have, the more our metabolism kind of just slows down a little bit more and more and more. And with menopause, sometimes we know that there are like different, like she mentioned, the cravings, but we know what brings about these cravings, what brings about the hot flashes, and sometimes we don't avoid them. Things such as chocolate, caffeine, and the things that we should stay away from. And as far as trying to, the main thing is trying to rev up that metabolism again. And the only way that we could really scientifically proven to rev up the metabolism consistently is through exercise. Will we get a spike in our metabolism if we drink a little bit of caffeine? Yes, but to consistently keep that metabolism going and really pushing is through exercise. And the more, and I know it's, it gets a little bit harder with, everyday life and everything, but you must exercise as our metabolism goes down. And this happens even with weight loss. So you will see some patients that have had weight regain. They'll, after weight loss, they did a study on, I think it was The Biggest Loser, competitors, what happened after, they left The Biggest Loser house and they gained this weight back again. Well, when you lose weight, and when you have like the bariatric surgeries and stuff, our metabolism goes down, and because the body no longer requires like, oh wait, I don't need so much energy anymore, because they don't have as much body mass anymore. So the metabolism goes down. If you don't consistently exercise, it will continue to just kind of dwindle on down. So exercise to keep our metabolism revved up. And as we're exercising, of course, keeping up with what we are intaking as well. But it's with menopause, yes, you will have like the hormonal imbalances that take place. And it's a rough period at times, but there are things that we can do and things that we can avoid to help us during that time. And it's just going to be a little bit, yes, weight won't come off as easy as it did when we were 20 or 16, 18. When we get older, we just have to really kick it into gear, our exercise, and be very cognizant of what we're putting into our bodies, like going all the way back to the tracker, tracking really what you eat. Because you'll say, oh, I don't really eat that much, but you're not tracking those 3 and 4 M&Ms that you put in your mouth, while you were, on the computer or something. And that, like, unconsciously, we're doing this and don't even realize it. So very important to do. Just try to track your food as much as possible and get that exercise in.
Wow. So Dr. Francois, we're out of time. We'll take your last question.
I don't have a question. I just wanted to respond to what was asked about flaxseed oil right quickly.
She said it was black seed oil.
Black seed oil. Okay, black seed oil. It's flack or black? Okay, black seed oil. Okay, it should figure very highly into the diet because it's one of the omega-3 fatty acids along with flaxseed. But I thought you said flaxseed.
Right, flaxseed, that is an omega-3. That's very helpful with decreasing our cholesterol levels and help keeping our intestines regular. Very, very good. Flax seeds are very, very good nutritious for us.
So we're out of time, but I want to say thank you, Dr. Francois.
Oh, you're welcome.
For this information. So constituents, the conversation doesn't stop here about weight management. We're going to ask that you take it back to your churches and begin to have this same conversation because we want to live healthy, happy, and holy. And the way we do that is we take care of our body as God's temple of whatever we eat, whatever we drink, whatever we do, that we do all to the glory of God. Thank you for joining us for this segment. We're actually going to transition, and we have Dr. Brenda Owusu, who's going to talk about empowering as we become older. So you don't want to move, stay in your seats, and we will be right back. Thank you again, Dr. Francois.
You're most welcome.
I do have some of her cards that are listed, that are on the health table, so I would encourage you to go by, pick up some cards if you need them as a reference, or would like to reach out and contact her. Till next time.